Hi, this is Dr. Patrick Harlan again. I'm a veterinarian here at Imperial Highway Animal Clinic, and I'm going to talk with you about our recommended vaccine protocol for our dogs. First is the DHPP vaccine. This is a 5-in-1 vaccine, and the first of it covers the canine infectious tracheobronchitis and hepatitis. This is an adenovirus 1 and 2 strain, and these two pathogens contribute to infections that can lead to severe liver disease and what we call the canine infectious respiratory disease complex, also known as kennel cough. These infections are highly contagious, transmitted through aerosolized droplets from coughing in the air or onto objects. Cross protection with this vaccine is achieved for both infections. Second is distemper. Canine distemper, or caused by the morbillivirus, is related to the measles virus in humans and attacks the respiratory tract, digestive tract, and nervous system. Respiratory and digestive tract symptoms are typically first to present in our dogs, and this includes vomiting, diarrhea, eye and nose discharge, or a cough, with late stages of the infection causing neurologic symptoms and damage, which can be permanent. This infection is also a contributor to the kennel cough complex and has a high death rate, which stresses the importance of immunization. Third is the canine parvovirus, which we are familiar with. This causes an infection which leads to the digestive tract and immune system destruction. Symptoms are typically vomiting and bloody diarrhea with a hallmark metallic smell to the stool. This is a hardy virus that survives in the environment outside a host for months. Strong disinfectants and bleach dilutions are needed to eradicate it. Fifth in this vaccine is the canine parainfluenza virus. This is another contributor to the canine cough complex with symptoms related to the respiratory tract. Now, our hospital recommendation for this vaccine is to start at 6 to 8 weeks of age, then booster at 3 to 4 weeks until 16 weeks of age, or at least 3 rounds of the vaccine. After puppy immunizations are finished, we booster in 1 year and then every 3 years thereafter. Next, I want to talk to you about the leptospirosis vaccine. This is a vaccine for an infection caused by bacteria that can damage the kidneys and liver, leading to digestive distress and risk of liver and kidney failure. This infection is zoonotic, with the risk of transmission through any contact with the urine of an infected animal. In suburban areas near wildlife reservoirs or parks, there is a higher risk of pets contracting this infection due to flooding of wildlife runoff during the rainy season. We recommend starting this vaccination at 8 weeks of age or at the second booster of the DHPP vaccination protocol. We then booster this again in 2 to 4 weeks and once yearly thereafter. Next is the Bordetella vaccine. It is a highly contagious infection that is transmitted via direct contact with an infected animal or aerosolized droplets. Our hospital recommendations is to start this injectable vaccine at the third booster of the distemper parvo series, or at least 8 weeks of age. We then booster in 2 to 4 weeks, and then once yearly thereafter. Next is canine influenza. This too is a contributor to the kennel cough complex. There are a lot of them. And there is 2 strains that we worry about in our dogs, the H3N8 and the H3N2 strains. Both can cause upper and lower respiratory tract disease that can progress to pneumonia. Like the human equivalent, vaccination lessens the severity, duration, and shedding of the disease to other individuals. It is not considered zoonotic. Our recommendations for this vaccine is to start at 6 to 8 weeks of age, then booster in 2 to 4 weeks, and once yearly vaccination thereafter to keep your pet protected. Lastly is the rabies virus. This is an infection that can affect all mammals in the world. Again, county regulation mandates that vaccination begin no earlier than 16 weeks of age. We then booster in a year and then every 3 years thereafter. That's about all I wanted to talk to you about the vaccines for our dogs. Thank you for watching.